Hi, welcome to Ascension Sacred Heart Emerald Coast Total Joint Replacement Pre-Op Education class. My name is Stacy Dancer, and I am the Total Joint Replacement Coordinator here. Also, Zula Swanson's name is under there. She is the spine coordinator, but we also cross cover for each other, so you may see her as well. My office phone number is 850-278-3646. Who we are, our hospital and orthopedic program awards. The Joint Commission has certified us as total hip and total knee disease-specific certification. We have a gold seal of approval displayed in the hospital. We are accredited every 2 years, and we collect data and have program performance measures to meet. I collect that data, and I interact with the patients and the staff to meet certain measures and have a level of specialty there. Center for Medicare Services, 5-star for a hip, knee, and outstanding patient experience. Performance Research Consultants, 5-star award for excellence in healthcare. Healthgrades, outstanding patient experience. And then Truven Analytics, recognized 5 times as one of the nation's 100 top hospitals for patient satisfaction for orthopedic and spine surgery. The purpose of this total joint replacement class is to educate and inform our patients, reduce anxiety about surgery, improve your outcomes, and give you patient resources you may not have realized. So the patients who watch this video, we can tell when they come into the hospital, they aren't as anxious. They don't have as many questions. We can restate whatever they did not understand, but they generally know how it's going to go and some of the more realistic expectations. This can improve outcomes, and then your resources are there because you've had it explained to you ahead of time. And it makes a more pleasant experience when you're educated about the process. The subject matter I'll cover here is preoperative preparation and exercises, what to expect at our hospital, discharge information, home care and safety checklist, and then what your role is as the patient. Information we do not cover is details about your procedure approach and differences, implant brands, decision to use or not use devices. Example, it would be robot versus non, or which approach the surgeon has. That is a conversation to have with your surgeon, and then in pre-op specific to you, we can explain further if there are more questions. Also, YouTube does have videos of different surgeries. Sometimes it's with a model that's not a human body, and other times with a human body, so feel free to look for that, but if it's going to raise your anxiety, maybe wait till after. You know yourself. For surgery preparation, a preoperative history and physical has to be within 30 days of your surgery date. If there are any tests outstanding, follow up at your surgeon's office to be sure they've received it. Complete any surgical clearance needed, such as cardiac. Attend the pre-op class, which is this one. Good job. Perform exercise program twice daily if they don't hurt you. And I'm speaking of the ones in the back of our book or anything your surgeon gave you. Complete any pre-admission tests required for you. Examples could be an EKG or your heart rhythm, blood test, urinalysis, chest x-ray. Patient reported outcomes survey, PRO survey. If you have given consent for electronic communication, this is a required process that we do, that the Centers for Medicare is requiring. So what it is, it comes to your text and or email, and it will say it's from Ascension Technologies. It will ask your last name and your birth year, and then it takes you to a survey to find out how you are before surgery, moving around, health assessment, etc. Then after surgery, you're going to have a 3-month, 6-month, 9-month, and 12-month follow-up surveys where they are following you for a year, gathering data on how you did after surgery. And this is how we improve processes for others in the future. For surgery preparation, home preparation and safety tips. Mine is to think of who's going to cook for you if you're the cook. So eat lean proteins, low-fat foods, drink plenty of water, maybe cook and freeze meals. Think of what delivery service or who's going to bring you some meals so that you aren't at home and then wondering what to do about all of that, especially if you live alone. Rearrange some kitchen items so you aren't reaching up high and down low. Same thing in the laundry room. Clear your furniture paths for ambulation with a walker. Be sure your walker won't get caught on a rug or cords. You can tape cords down. You can remove rugs. We don't want you catching your toe on anything and having any type of fall, and the walker keeps you from doing that because you can catch yourself with the walker. So please use the walker the first week for sure. Consider your sleeping quarters, being sure that you have everything that you need on your nightstand so that you aren't trying to get up in the middle of the night. The least amount of times getting up in the middle of the night gives you better rest, but less chance of being dizzy and falling, stuff like that. Orthostatic hypotension is an issue after surgery and with pain medicine, and some people have that already. When you get up real fast and get dizzy and your blood pressure kind of drops, that's what that is. So give yourself time to sit up and regulate. Then when you stand, regulate, maybe march in place before you start to move forward. Nothing should be going super quick right after surgery. In the bathroom, think about non-skid bath mats, maybe a chair if you need to transfer over into a bathtub to stand. Only showers are permitted until your dressing is gone and the surgeon says you can have a bath. Only showers. A handheld shower sprayer is helpful if you have that. Keep your grooming items within reach. So before you get into the shower, have everything all set. The stage is set. If you need to arrange pet care, please do that. If you have a dog or cat going to jump up on you or tangle up on your feet, have a plan for that so that it's not a fall issue. We ask that you do not allow pets to sleep in the bed with you for a week. I know that can be difficult, but a pet that gets on top of your operative leg or restricts your movement in the bed, or if dander and saliva and claws compromise your dressing site, that can cause bacteria to have a way to get in there and cause problems beneath the surface. So please be mindful of that. And have your chores completed before surgery. You don't want to have a bunch of dishes or laundry to do and things that are unkept that you're going to feel like doing. You want to get done and then you can't because your mobility is limited. Clean your bedding and for infection prevention. Maybe have a new towel every time you take a shower for a week. Just really think of those things, what you can do to reduce bacteria around your surgical site. And reading your joint replacement book, that'll help with repetition of information so you can retain more information. This is a picture of our joint replacement packet. I make these packets and they are located at the hospital front entrance desk, and I also get them delivered out to the surgeon's offices. However, sometimes the surgeon's offices may be out of them. If so, I can mail one to your house if you live too far from the hospital and you aren't coming here for tests. If you are coming here for tests, such as a CT, something like that before surgery, you can ask for it then. If you already have one, then don't accept one from the surgeon's office. That just makes it where I have to deliver more often. But inside of that, it has a HIPAA soap in there for 3 showers we like you to have before surgery, and then our joint replacement book. And here is a picture of the joint replacement book and a bottle of soap. It is chlorhexidine gluconate. HIPAA is another brand name for it. Some surgeons may give out some sponges for showers. We give this one for all surgeons to be covered, and for patients to do 3 showers is what we prefer here at the hospital. Preoperative exercises are illustrated in our joint replacement book. In the back of the book, there are exercises and body mechanics for knees, hips, and shoulders. If anything hurts, as I've stated before, don't do that. Your joint isn't fixed yet, so if something's uncomfortable, don't do that. Wait until after surgery. But ankle pumps, quad sets, glute sets, straight leg raises, heel slides, short arc quads, long arc quads, and chair push-ups. You can look those up if you don't have a picture of them, if our book isn't with you yet. And the chair push-ups are very valuable for using your walker. 1 week before surgery, stopping medications. I have a list of some there. If you have a blood thinner that's prescribed by a specialist and you are not able to stop it before surgery because they said you cannot, we will adjust anesthesia how we need to. However, anything that thins your blood, we're asking you to stop that 7 days before surgery. Some of the thinners are 5 to 7 days, others might be 3. Just be sure it's a complete 72 hours. If you take something at night and then you come in surgery in the morning, then you needed to stop that one at an extra night before to make it 72 hours before you're having surgery. Herbal supplements and over-the-counter vitamins, your anti-inflammatory medications, all are blood thinners. So you can discuss pain control with your surgeon further if that's what you normally use. All surgeons do approve Tylenol. 6 to 8 hours, every 6 to 8 hours is needed for pain. A person who's under 150 pounds, 3,000 milligrams in 24 hours. A person who is 150 and above pounds can take 4,000 milligrams in a 24-hour period. All that is safe amounts for short-term use. Discuss any other medications you can take for pain with your surgeon. So if you just can't do the Tylenol or it doesn't do anything for you, talk to your surgeon. And at the hospital, we practice multimodal pain relief measures. So that would be moving often, applying ice, and then medication after that. Might be anti-inflammatories, opioids, Tylenol. There is an opioid epidemic that we do our best to do the least amount of opioids necessary to be a controlled level of pain for you to move around and meet your goals. That's very different from one person to the next, so whatever keeps you moving is correct for you, and it should reduce as you go. Do not shave or wax on or near your surgical area starting 3 days before surgery. We will do that at the last minute before surgery. There can be micro tears in your skin where bacteria can kind of hang out, and then we're going to come in and do the surgical incision that goes down deep. That is why we want you to do the pre-surgical showers and not shave or wax 3 days before surgery. Surgery preparation the week before surgery, you're going to have a pre-admitting phone call from our PAT department. Usually it's within 3 to 7 days of surgery. They will go over your health history, any labs that you need, allergies, your medications. They'll tell you what you can take the morning of surgery. Final preoperative instructions. Arrival times may be given depending on what the surgeon's preference is for that, and then you may be called back with a different arrival time based on the surgeon's schedule and things that happen, where someone may need to be moved or canceled or added on, things like that. It's the surgeon's schedule with his time at our hospital. The night before surgery, take a shower with your special soap, the Hibiclens. Actually, 2 nights before surgery is what we want, the night before surgery and the morning of surgery. You may wash your hair, but don't put any products in it. Flammable products are not a good idea. Do not apply lotions, powders, perfume to the area around your surgical site or on your chest and abdomen, as we put heart monitor pads on there, and then we have to wipe it clean with alcohol wipes in order to make it stick during surgery. Sleep with clean pajamas and clean sheets. Nothing to eat or drink 8 hours before surgery. But you can have, for joint patients, up to 20 ounces of clear liquids 2 hours before arrival time or 4 hours before surgery time. No milk products, no protein, clear liquids like Gatorade. There is a flyer in our book that has approved clear liquids. And this is it here. If you have a question, you can call me or respond to my email. Okay. No chewing tobacco, no nicotine products, candy, gum, ice, chips, no vaping, no dipping, nothing with nicotine in it, please. This can postpone your surgery till later in the day or cancel altogether for that day, depending on what we can accommodate. No smoking after midnight. Every attempt to quit smoking should be made 2 weeks before surgery for your best outcomes. You will heal better. It's never too late. Surgery preparation, again, the day and night before surgery, items to pack in case you do stay. Your ID and insurance card that's active needs to be with you, and if you have an advance directive, you can bring that too. The joint replacement booklet's a good idea. Personal care items that are in your flavor and brand, like toothpaste, toothbrush, deodorant. If not, we have a generic set. Hairbrush and comb if you want makeup. CPAP, if you use one, we like you to have your own, and then comfortable clothing, keeping in mind which surgery you had to make it easy on, easy off. Non-slip soles that have a heel cup on them, so no flip-flops, something that has a heel cup and it's steady and your foot does not slide around. Assistive device, your walker. We want you to have your own walker so we can adjust it to your height if we see the need for it and make sure that it works correctly. The metal one that folds out with the 2 wheels on the front, no wheels on the back, is the best one. So you're inside of a cage and can push down with your arms. So that's really the best one for recovery. You do not need items such as jewelry and money. And for surgery, you should remove metal objects. We do use cautery in surgery, and metal is not recommended. Take a shower the third day, the third shower with your soap and that we gave you in the packet, and or sponges maybe you got from your surgeon. Clean, comfy clothes, nothing to eat or drink except for the clear liquids allowed, 20 ounces, 4 hours before surgery. Do not smoke, dip, chew tobacco. Please do not wear makeup again. Nail polish, you can have one unpolished finger on each hand. If it's dark polish, if you have your nails done, usually your nail salon will work with you to fix that after surgery. Lotions, powders, perfumes, leave those alone that don't have those on. Please be on time and notify us if you're delayed. If one patient shows up late and the other patient is not here, it kind of sets the whole day back. So please be here on time. Occasionally, there'll be a reason to delay the person in front of you and you move into their spot, and it keeps everything flowing for that day. So please let us know if you're going to be delayed. Pre-op area, usually one guest in the pre-op area when everything's happening with you, when everything settles and you're just waiting. They may allow more back there, but it is an active area with several providers coming up and doing their part. And then there's not a lot of room in the pre-op bays, and nurses are on each side of the bed doing things. So one person is the best to have at first, for sure. Bring to the pre-op area your list of medications and allergies. We really need that, and we're going to be recording the last time you took your medications. Protective glasses, cases for glasses, dentures, hearing aids, and no contacts. You can have a corneal abrasion from wearing contacts in surgery. No contacts are allowed. Something to occupy your time. There are TVs in there. And occupy your time when you're done being interviewed. Please, when you're being interviewed, pay attention and answer the questions so that we can do everything timely and completely for you. And bring your walker in. We'll take it down to recovery for you. When you're in the pre-op area, you'll change into a hospital gown. The pre-op nurses will take vitals. They'll perform a quick health assessment and start possibly 2 IVs. You'll sign paperwork necessary to your procedure, surgical consent, anesthesia consent, etc. Your surgeon must make a mark near your surgical site before you're taken to the OR. And unless your surgery is at 7 a.m., all surgery times are approximations. There are times when we're going faster. There are other times we might be delayed a little bit. It's just not an exact situation all the time. But we do a really good job. And part of it is with our patients showing up on time. Thank you. When you go into the operating room, you may be awake, but you will have received medications to relax you. I call it the I don't care medicine, and it's Versed is usually what is used. Some patients are a little snoozy, others might be awake but just relaxed and you're not too worried about it. Sometimes you don't remember any of the conversations at all until you wake up in recovery. Once you're in the operating room, you're going to have monitoring devices on. Anesthesia staff will finish giving you your anesthesia as discussed, and surgical site will be prepped. Spinal anesthesia versus endotracheal general anesthesia. We choose spinal anesthesia first. You're breathing on your own in surgery, kept to sleep with an IV medication. Usually that's propofol or diprovan is the other name, just like in a colonoscopy, that type of thing. And then you don't have feeling below the navel, and then that gradually comes back when you're in recovery. And we have some shorter acting medications these days. It wears off pretty quick. Pain comes back a little more subtly. When you do need to have general endotracheal anesthesia, that's when you have a tube in your throat breathing for you, and you have gases involved in that. Sometimes that's what makes you more nauseated or blood pressure issues. So you may recover really quickly. You may have a little prolonged. And when you go to recovery, you may have pain, and the nurse will treat that. Local anesthetic is usually injected at the surgical site. That is somewhat helpful from the surgeon before you leave the OR. Surgeries usually last approximately 1 to 2 hours in the room. Sometimes it can be longer, especially if it is a revision. It just varies, but 1 to 2 hours in general. Recovery is approximately 2 to 4 hours, so just plan on being in recovery between 2 and 4 hours, and then hopefully you'll be continuing on to discharging. So in recovery, our PACU, post-anesthesia recovery unit, you're going to have vital signs, pain, and neuromuscular assessments done regularly. Your surgeon will call your family at the end of surgery. You'll be receiving IV fluids until you're eating and everything's great. X-ray of your new joint will be done. You'll recover in PACU with the intention for you to go home from PACU. Physical therapy or the RM walks you to be sure you can walk far enough to get from your car into your home. Hip patients will have an ice pack applied. Knee and shoulder patients will have a cryo cuff cooling device or an ice pack, depending on whether you had a cooling device delivered to your home. We will use a sequential compression device on your legs until you're moving. Those are SCDs is what they're called. Same day DC is what we are expecting. With an outpatient or inpatient definition for insurances, this primary hip or knee is considered outpatient surgery. Many of these are also done at surgery centers. Inpatient definition is anytime there is hardware already there that's being removed or a revision of a total joint, something like that. That's inpatient. And those sometimes they stay, sometimes they go home, sometimes they want to go home, and we have to evaluate to see if they can. And sometimes the choice is just they're going to stay inpatient overnight. Pain control. For most surgeries, pain is to be expected. Multimodal pain relief strategies, medication, early mobility, ice therapy are those. We try to make it manageable, but we cannot promise there's no pain from having a joint replaced. If you do stay overnight, we have 2 east and 2 northwest is where you will likely go. It's the picture inside one of the rooms. They're private. One family member can stay. There's meal service, call lights, bedside commode, television, and phone, and the expected length of stay is just the overnight. Nursing assessments are performed regularly, so you'll have 2 nurses in a 24-hour period as there are 12-hour shifts here. Regular diet, you can order ahead at 3663, spells food on that phone. You'll receive IV fluids and antibiotics, but once you're eating and drinking well, IV fluids can be stopped. If you are diabetic, blood sugars are monitored to keep below 200 for good healing. If you've had steroids and then your body's under stress from surgery, it may be more elevated. Inpatient stay continued. PT and OT will see you in the morning to clear you for surgery. And then incentive spirometer is a picture right there. That's to exercise your lungs to keep you from getting pneumonia. And guarding. People who are in pain tend to guard and not take deep breaths, and then fluid can kind of settle in down there. So that's why we have you inhaling with this incentive spirometer. IS is what we use for abbreviation for you. Every hour when you're awake is what we say. Do about 10 breaths on that, and it's quite a workout. Rehab and walking. Once you're able to walk, same day surgery will have you up on your feet, usually within 4 hours with a nurse or physical therapy. This decreases the risk for blood clots and stiff joints. Up every hour at home. When you're here, you have to call for help. Window of rehab is 6 to 12 weeks, and that's the most important window of this process. So give it your all. Fall risk. Please call, don't fall. So you're going to have a yellow gown on, yellow socks, saying that you're a fall risk. So you need to have assistance anytime you get up out of the bed. We can't stress this enough. You're in an odd place. You're on medications. You're hooked up to things. You've got a new joint. You're going to need assistance if you're staying here in the hospital like that. If you have a blood draw ordered, that's between usually 2 and 4 in the morning, so that those are ready for the surgeon when he rounds to see what it is. Your pain meds, you will have usually a scheduled Tylenol, large dose of Tylenol, and then you have to ask for narcotics as needed, usually 4 to 6 hours. If you have a drain, they'll be removed before discharge. Once you're eating and drinking and voiding adequately, you do not need IV fluids. And then if you need help with anything, social workers check on you for that. If home health is not set up already, or there's another need that we find out about. Physical therapy will evaluate you in the morning, as I said, and occupational therapy with activities of daily living, getting dressed, bath, changing clothes, etc. We want you to walk often with assistance and use your incentive spirometer, and your goal is to discharge. And you must have transportation at discharge. Now, with that, think of the proper height of a car or a truck. Try not to come with a really high truck or a very, very low car. It's not the best for you to get in and out of again. Please take your pain medicine to stay ahead of the pain, gradually reducing as your pain decreases. Change your position often, move often. If you're a knee patient, no pillow under your knee, keeping it in a bent position. You want to work on elevating and straightening your leg. Change in body functions. Your appetite may be decreased. Protein is super important. Eat well-balanced meals, prevent constipation, eat more fiber, take your stool softeners. You'll probably have a little bit of a disturbance in your sleep pattern. Home PT is usually ordered prior to your follow-up appointment. You may request an agency if you have a preference, and Blue Cross Blue Shield normally chooses for you. An option to research agencies serving your zip code is at the Medicare.gov website, and this is what it looks like. At the bottom, it says Home Health Services. You go there, put in your zip code, and what you're looking for, and it will come up with some recommendations according to ratings. Your post-operative dressing is like this, Aquacells. They are waterproof for showers only. So please, only showers, nothing submerging it until your surgeon says that you can. Please feel free to ask any questions at stacy.dancer@ascension.org, and my dancer has an S in it. And we look forward to seeing you soon. Thank you so much for choosing Ascension Sacred Heart Emerald Coast. We look forward to serving you, and hopefully you will have an optimum surgical experience.